Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Complement deficiency and the associated diseases. So let's look at the complement proteins. So first one is the C1, the C2 as well as the C4. So 1, 2, 4. So the effects and deficiency, it includes the immune complex diseases such as the SLE. Next, let's look at the C3 and F1, the factor 1. So this is susceptible to the capsulated bacteria. So it's a capsulated bacteria. Next is the C5 to C9. So what is seen in C5 to C9? It is a susceptibility to the Neisseria. So it is susceptible to the Neisseria. Then comes the factor D. So there is factor D as well as a properidine. So factor D and properidine. So this is nothing but the factor P. So all this is associated with the susceptibility to the capsulated bacteria and the Neisseria. So it is a capsulated bacteria as well as a Neisseria. C5 to 9 is the susceptibility to the Neisseria. C3 and factor 1 is related to the capsulated bacteria. Now let's move on to the DAF. So when you look at DAF, it is a decay accelerating factor. So decay accelerating factor. So then we also have the CD59. So both of them, they are associated with the paroxysmal nocturnal hemoglobinuria. Paroxysmal nocturnal hemoglobinuria. Then let's look at C1. The C1 inhibitor. The C1 inhibitor is associated with the hereditary angioneurotic edema. So C1 inhibitor is hereditary angioneurotic edema. To learn and grow daily like this, please do subscribe.